Hi, I'm Dr. Karen Playforth. I'm an OBGYN at the University of Kentucky within the Division of Maternal Fetal Medicine, and I subspecialize in taking care of women with diabetes complicating their pregnancies. Gestational diabetes occurs when the body cannot make enough insulin due to the normal hormonal changes of pregnancy and also due to some of the factors like age, number of babies that mom is carrying, her weight, and ethnicity. There are no real noticeable symptoms for gestational diabetes, so it's important that you talk to your doctor about getting tested for gestational diabetes.
Hi, my name is Liz Combs. I'm a registered dietitian and work at UK in the Department of Dietetics and Human Nutrition as a senior lecturer. Today we're going to be making a recipe that's perfect for those with gestational diabetes, type 2 diabetes, or just anybody who wants a nutritious meal. We're going to make some white bean soup, which is a veggie-packed favorite on our old recipe. Also, it's less than $2 per serving, so it's a great meal any time of the year. So let's get cooking.
This is a super simple recipe. We're going to start by adding a little bit of oil to our pan until it gets hot, and then go ahead and put in the onions. We're just going to saute them gently until they kind of become translucent, and you can see through them and they're nice and soft. All right, next we're going to add some carrots for a pop of color. A little bit later we'll add some spinach too. And we chose both of these green and orange veggies for the recipe to give it that color because they often have a huge boost of vitamins and minerals. When in doubt nutrition, just try to eat as many colors as possible. Next we're going to add the beans, and beans are an amazing source of both protein and dietary fiber. Both of these nutrients can help slow digestion and help keep you fuller longer, which can both help keep your blood sugar steady. If using canned beans, just be sure to rinse and drain them as they can sometimes contain a lot of salt. So we're going to add the vegetable stock, but if you don't have that around, you can use chicken stock instead, just whatever you have on hand. And now we're adding the spinach, and along with the carrots, they both add a pop of color. Anytime that we see extra color, it usually means extra nutrients, so don't be afraid to add them to your next meal. A great thing about this recipe is that you can make it your own. Whatever you have in the pantry, extra vegetables or other beans, feel free to add it to this, and it can help add more nutrition as well. All right, let's give this one more quick stir, and now we're going to turn the heat down to low and let it simmer for about 15 to 20 minutes with the lid on.
When a patient receives a diagnosis of gestational diabetes, the first thing I usually do is recommend some diet and lifestyle changes. I recommend that they emphasize whole foods such as fruits, vegetables, good protein sources, and that they start getting enough activity, about 30 minutes per day if possible.
This soup is incredibly simple and can freeze well for up to 6 months. Just pop it in the microwave or on top of the stove whenever you're ready, which could be perfect for once baby arrives. Having gestational diabetes can be really scary, but with the proper support and a nutritious diet, it can help manage some of your symptoms. I can't wait to try it.